Hi everyone, this is Cami with Brook, and we're going to be talking about sleep care. In this talk, we'll learn about the importance of sleep for our bodies, mind, and beyond. And we'll also learn about what getting restful sleep can do beyond your mental and physical states. Then we'll discuss some tips for getting better sleep every night. Getting a restful night's sleep has many direct benefits. Every night when we go to sleep, we have a regeneration of our entire system where it improves our cell and muscle growth. Through getting enough sleep, we can also improve how we deal with stress and how we manage stress. And it also improves our immune function. Those who get restful sleep every night see an improvement in blood pressure regulation, which can reduce our risk for heart disease. Also, sleep can help with proper calorie regulation. It helps with identifying and regulating the hormones that are secreted when we're hungry and when we're feeling full, so that we can also connect that to our brains and know when we're feeling hungry and when we're feeling full, which ends in calorie regulation. Those that got proper sleep every night can see also a lower inflammation in the body, and the way that our body reduces that inflammation is bettered through restful sleep. Sleep doesn't just also improve our physical system, but it can improve our mental system as well. It improves our mood, our energy, and our entire mental status. People that get restful sleep might experience more flexibility and more resiliency in their mental status, and they also might get the benefits of promoting concentration and memory. There's also some downstream benefits of getting restful sleep. It can improve our relationships because it increases our emotional resilience and our ability to problem solve. We tend to be a little bit less irritable and more just in general having a more positive outlook and more energy within our moods and our mental states. It can even improve work environments by improving productivity, concentration, the management of stress that we feel within our work environment, and the regulation of our emotions. As some of you might know, there are specific stages of sleep. Researchers have narrowed these down to 2 different stages. There's quiet sleep or non-REM sleep, and dreaming sleep or REM sleep. You might already have heard of REM sleep. It's known as rapid eye movement. This is where your eyes truly are moving, but the rest of your body isn't. Within the quiet sleep stage, there are 3 additional stages. The first stage, being N1, is where our body is drifting into sleep for the first 10 to 20 minutes of us laying down. This is where the body's temperature slightly drops, our muscles tend to relax, and our eyes start to move slowly from side to side. The next stage, N2, is the next 10 to 25 minutes of progressing into sleep. This is where our heart rate drops a little bit more and our breathing drops lower. We typically spend about half the night in the stage N2 when we're sleeping. The next stage is N3, and this is the last stage of quiet sleep. This is considered the deep sleep stage. This is where the body truly repairs itself. It's where tissue growth and muscle repair happen. When somebody has a long period of sleep deprivation, they tend to quickly pass through the lighter stages of sleep quicker and into the deep stages and spend more time there throughout the night. The deep sleep stage plays a large role in restoring alertness in a person's optimal functioning. The next stage is the dreaming sleep or REM sleep stage for that rapid eye movement. Again, this is truly where we are paralyzed, essentially, and our eyes are moving rapidly. Our brain is very active here. This stage typically facilitates learning and memory, and a lot of people can go through REM 3 to 5 times throughout the night. Let's talk about tips for restful sleep. It's important to create a sleep routine. This is a routine that focuses on similar wake up and go to sleep times. In this routine, you should also be practicing reducing screen time at a minimum to 30 or 15 minutes before bedtime. Also, lowering the room temperature to about 65 degrees Fahrenheit or lower can help with restful sleep. And reducing caffeine in the afternoon. Caffeine is a stimulant and it stays in your system for 8 to 12 hours, and it can reduce the quality and quantity of sleep that you can get. Creating a bedtime routine is equally as important as your sleep routine. These bedtime routine activities can focus on calming things like reading, bedtime yoga, or drinking herbal tea, among other things. It's important to implement this at least 30 to 60 minutes before you go to bed to get yourself into that relaxation state and to prepare your body for sleep. Also equally as important as the routines that we just talked about is these routines, like getting regular physical activity each day. Try to do your activity in the morning or in the middle of the day and not right before bedtime. If you do a bedtime activity, do something that's calming and that allows stretch and elongation of your muscles before priming you to go to sleep. If you do a physical activity that is more intense or vigorous, it can actually keep you awake in the middle of the night. Some activities have revealed that daily exercise reduced the time it took to fall asleep by 55% and increased total sleep time by 18%, thus improving quality and quantity of sleep. Also, practicing stress management techniques. As we talked about earlier, sleep can reduce stress and help us manage stress. But it's important to have coping or management techniques in place so that you feel like you're reducing stress throughout the day. The less stress that you have and that's going through your mind before you go to sleep, the better. A lot of people, ironically, use the few minutes before sleep to think about what happened during the day and to process it again, and even think about what's going to happen in the future, such as the next day. This is a great practice to have, but just include it so it's at least 30 minutes or 60 minutes before bedtime so that you're not thinking about all of those things before bedtime and inadvertently stressing yourself out. Also, lastly, reduce the alcohol intake and fluids before bed. Both alcohol and fluids can increase the number of wake-ups in the middle of the night because they increase how much fluid you have to excrete, i.e. going to the bathroom. But also, drinking alcohol right before bed can actually interrupt our circadian rhythm. It can cause micro wake-ups during the night. So to wrap up, it's really important to get restful sleep, and there are many ways to promote restful sleep. As you've seen in the slides, there are different ways that you can take advantage of. Take a look at what things you're doing currently within your lifestyle and what things you might want to add or change. Chat with our Brook experts about those changes and to set goals around them. We're happy to support you and to answer any questions that you might have. Thank you so much for joining me on this talk. We'll chat soon.